You're in the kitchen, reaching for a cup that's on a high shelf, and all of a sudden you get this twinge in your shoulder. Naturally, you think it's no big deal, or it will go away on its own. But what if you had a minor sprain, muscle imbalance, or even worse? And what if I told you most common shoulder injuries can benefit from conservative rehabilitation? I've been a therapist for 20 years, and it's my privilege to give you free and expert advice on different aspects of rehabilitation. Flow Motion Physical Therapy Specialist is all about providing free expert value. And now you can reach out to us on different platforms that are linked in the description. That way we can discuss your specific situation. Today we'll be discussing some of the most common minor shoulder injuries and approaching them in a conservative manner. But first, we want to remind you that this video is for educational purposes and should not be used to diagnose or treat any medical condition. Always consult with your healthcare professional before starting a new exercise routine, or if you're experiencing pain and discomfort that is getting worse. No pain, no gain doesn't apply, and some pain means stop what you're doing and find another approach. Now let's dive into some common shoulder injuries. The shoulder joint is one of the most complex and mobile joints in the body, which makes it more prone to injury. Some of the most common injuries include shoulder sprains, shoulder impingement, rotator cuff tears, and muscle imbalances. All of these injuries have some common symptoms we can all relate to, like pain, stiffness, and weakness in the shoulder. Let's get into shoulder sprains first. A sprain occurs when a ligament in the shoulder is stretched or torn. Symptoms may include pain, swelling, and difficulty moving the shoulder. The safest approach to treating a common shoulder sprain is to rest the shoulder, apply ice, and reduce swelling. Take over-the-counter pain medication with your doctor's consent. Depending on the severity of the sprain, a healthcare professional may recommend physical therapy to help improve your range of motion and strengthen the shoulder. Then we have shoulder impingement. Impingement occurs when the tendons in the shoulder become pinched or compressed. Symptoms may include pain and weakness in the shoulder, especially when raising the arm. The safest approach to treating shoulder impingement is to rest the shoulder, avoid activities that aggravate the symptoms, and perform exercises to strengthen the rotator cuff muscles. We will be reviewing these exercises later in the video. Remember, physical therapists like me may need to go through an evaluation to help improve your specific shoulder mechanics and reduce the risk of future impingement. Next, we have rotator cuff tears. A rotator cuff tear occurs when one or more of the tendons that attach to the rotator cuff muscles to the shoulder bone begins to tear. Symptoms may include pain, weakness, and difficulty lifting the arm. The safest approach here is treating the rotator cuff depends on the severity of the tear. For minor tears, rest and physical therapy to improve the shoulder mechanics and strengthen the rotator cuff muscles may be recommended. For more severe tears, surgery may be necessary to repair the torn tendon. Then we have muscle imbalances. Muscle imbalances occur when certain muscles in the shoulder are weaker or tighter than others. This can lead to poor posture and mechanics and increase the risk of injury. The safest approach to treating muscle imbalances is to work on strengthening the weaker muscles and stretching the tighter ones. A healthcare professional or physical therapist can provide exercises and stretches to your specific needs. It's important to note that these are general guidelines and every shoulder is unique. If you're experiencing pain or discomfort in your shoulder, it's always best to consult with a healthcare professional for an accurate diagnosis and treatment plan. With proper care, however, most shoulder injuries can successfully be managed and resolved. Thanks for watching so far. I know you're finding value in this content and would love to hear your thoughts on the video in the comments. So as you can see, most shoulder injuries share common signs. For example, weakness, pain, and limited range of motion. Let's keep it simple and effective. If you have pain, you need to rest and ice. If you have weakness and are pain-free, exercises to strengthen will help. If you have slightly limited motion or weakness in one direction with very little pain, stretching and exercise will help. And if it's complicated, please consult a professional. The following exercises will address the most common issues that shoulder injuries can cause. First, we have the shoulder pendulum swing. This is the easiest and most conservative shoulder exercise. This exercise involves gently swinging your arm back and forth while leaning over the table or a chair. This helps to increase blood flow to the shoulder joint and reduce stiffness. Shoulder shrugs. These provide a solid foundation for stability of the shoulder. Shrug your shoulders up towards your ears and then relax them back down. This exercise helps to strengthen the muscles in your upper back and shoulders. Shoulder retraction. This is also an initial conservative foundation exercise. Pull your shoulder blades back and together, hold for a few seconds, then release. This exercise helps to strengthen the muscles in your upper back and improve your posture. Shoulder abduction can be done with or without a weight as long as you stop before you feel pain. Don't push it. Raise your arm out to the side, keeping it straight. This exercise helps to strengthen the muscles in your shoulder and improve range of motion. Shoulder flexion. This can also be done with or without a small weight like a can of soup. But stop the exercise before you feel pain. Raise your arm straight up in front of you. This exercise helps to strengthen the muscles in your shoulder and improve range of motion. Shoulder circles. The next few exercises get a little harder and shouldn't be done until your shoulder has decreased in pain significantly. Rotate your arm in circles, both clockwise or counterclockwise, and gradually make the circles bigger. This exercise helps to improve range of motion in your shoulder. Shoulder press. Hold a light weight in each hand and press your arm straight up over your head. This exercise helps to strengthen the muscles in your shoulders and arms. Wall push-ups. Stand facing a wall and place your hands on the wall at shoulder height. Slowly lower your chest towards the wall and then push back up. This exercise helps to strengthen the muscles in your chest, shoulders, and arms. Some very gentle, pain-free stretching should be considered between you and your provider as long as you're showing improvement and have given yourself adequate time to rest and ice for up to 2 to 3 weeks. Stretching is considered when muscle imbalances and weakness are present, and we are trying to improve the mechanics of the shoulder. Gentle external rotation stretch with a towel. Hold a towel under and behind your arm as shown, with the bottom hand pulling the injured shoulder back gently. This exercise helps to stretch the muscles in your shoulder and improve your range of motion. Gentle internal rotation stretch with the towel. Hold the towel with one hand behind your back and use your other hand to gently pull it towards your head. This exercise also helps to stretch the muscles in your shoulder and improve range of motion. Remember, it's important to start slowly and gradually increase the intensity of your exercises as your shoulder improves. I want to leave you with a thought-provoking idea. Health is not just about what you're eating. It's also about what you're thinking and what you're saying. Remember that taking care of your physical health also means taking care of your mental and emotional health. With that said, I look forward to discussing the various aspects of weight management, emotional and mental health from a physical therapy perspective during the recovery process from an injury or surgery in future videos. Let's take action to improve our health and change our lives for the better. The last shoulder exercise I have for you today is very effective. Slowly but assertively lift your hand and hit the like and subscribe button with your finger. Thanks for watching. Have a good day.